within this project we interviewed 85 women veterans from across the UK, and we found that women veterans in our study had experienced a number of challenges in civilian life, and often these challenges were related to gendered experiences in military service. And these experiences included gender-based discrimination across their military service in different ways, and sexual harassment and sexual assault, which was fairly prevalent within our sample. And these experiences increased their need to access and engage with veteran support services in the civilian world. Women reported a number of barriers in accessing these support services, which meant that they often hadn't received the help that they needed or in fact were entitled to under the Armed Forces Covenant. And these barriers included a perception that veteran support services were designed and branded around the needs of men, and that this meant that these services couldn't meet the needs of women veterans. Based on these findings, we've made 30 key recommendations, and these recommendations are focused on ensuring that women veterans' needs are considered within the development of future UK policy and practice.
The background to the report was we'd done a community survey of about 750 female veterans from across the UK. And we found that 1 in 4 reported having experienced sexual trauma during their military careers. And we worked with the Office of Veterans Affairs to co-produce treatment guidance to understand the best evidence-based way of supporting survivors of sexual trauma. Our key recommendations were cognitive processing therapy is the best treatment to support female veterans who have survived military sexual trauma. What I'd recommend next, though, is working out ways to expand capacity in the availability of these clinical services across the UK.
We investigated how female veterans access service charities to allow us to recommend improvements. We interviewed 38 representatives of service and non-service charities, public sector organisations and academics. We found that women may not identify as veterans and may be reluctant to access support from service charities they associate with adverse experiences of military life. We also found many examples of best practice, including female-specific services and supportive communication. We make 21 recommendations, focusing on the need for more attention to aspects of safeguarding, differentiation of service for women, and greater collaboration between charities and other experts to improve access for female veterans.
I welcome these reports, which improve our evidence base and deepen our understanding of the unique experiences of women veterans. Now, we will use these reports alongside other research pieces on women veterans to inform our advice on the upcoming Women Veterans Strategy. The strategy is an exciting opportunity to recognise the experiences of women veterans and understand the impact of the support available to them, and to commit to what else needs to be done to better champion our female veterans.